During the COVID-19 pandemic, it was really evident early on that multicultural communities really had trouble accessing information in language, which is where we began the Multicultural Working Group, which helped Cultura and Barwon Health begin their partnership. Over the next 3 years, Carmel, Hadil and other team members at Cultura and myself spoke almost on a daily basis. It was a fast-paced environment where things were changing every day, and we really worked together to ensure that the communities had vital information in language, so they knew exactly what the restrictions were, the vaccinations and the information about vaccinations, where they could get a vaccination, to make sure that there were no barriers to accessing this.
The COVID pandemic was a once-in-a-100-year event for Australia and for the world, and it certainly posed many challenges. We were prepared for some contingencies, but certainly not the scale of the disease in Australia. But most importantly, once we had access to good vaccines, making sure that the public had the right information about the vaccines, that it was safe and effective, meant that we could provide the community with the right information about that. Also providing opportunities for targeted sessions and making sure that the community had opportunities to ask questions and have their concerns allayed with the right information.
When the COVID pandemic hit, we were all sent home. Our communities were sent home. Everyone was in lockdown. We weren't sure how we were going to communicate with them and get the really important messages across. We were concerned about the fear that was in the communities and the lack of knowledge that they had. Within a couple of days, we had set up a working group internally within Cultura. We started to send out voice messages with the support of bilingual support workers, and that at least got some information out to the communities. We were very concerned about the fear in the newly arrived communities from a refugee and asylum seeker background in particular, and we were able to get messaging out to them through religious leaders, people of influence in the community, the Geelong Ethnic Communities Council. When the working group was set up, we started our close relationship with Barwon Health. Through Sarah being involved on that working group, we started to work very closely together. Our videos started to get more creative, more professional. When Hadil came on board, we knew that the messaging was getting out there, it was being watched by communities. So we were able to keep that going. We were able to get messaging out very quickly to communities. Apart from the constant communication with ourselves and Barwon Health, we also got support with pop-up clinics, bilingual support for those clinics, much easier registration for community members. The staff at Barwon Health were fantastic with their patients and coming in and getting everything set up. When people had finished their vaccination and were sitting for their 15 minutes, we had information loaded onto iPads that they could watch in language so that they understood what the side effects might be. When there was a lot of misinformation out in the communities, Eugene was great in coming and speaking with our communities. On weekends, he met with church groups to try to dispel some of that misinformation, and then he would come in and work in the evenings with some of the community leaders just to make sure that the information they were giving their communities was correct. So we worked really closely over that whole period, and the work continues today to support the communities that we work with at Cultura.
One of the big challenges was making complex information easy to understand for the communities, especially that some of the communities cannot read their language because they were waiting in a third country since they were young. So we had to communicate through videos. Sometimes we had to get the message out on the same day, especially during the pandemic when restrictions were announced and came into effect immediately. We had to simplify information, work with the translators, create graphics, and send the message out in 6 languages within a few hours. We had great feedback from the communities about the videos. We've been informed that when one family member watches the video, they go and explain the information to other family members.
روزی که امی پروگرامی که اینجا بودک برای ما بسیار یک روز خوب بود. خوبی به اینجا بود که ما خود احساس کردیم که ما عضوی از امی خاک و از امی کشور هستیم که آمدن در رابطه با ساخت شفاخانه از ما نظرخواهی میکنند و نظرات ما را گرفتن در رابطه با ساخت شفاخانه و بعضی موضوعاتی که باید چه چیزایی در شفاخانه در نظر گرفته شود. این برای ما بسیار خوب بود و روز بسیار خوش بود. دومی که واکسینی که آورده بودن در رابطه با کووید و انفلوئنزا و ما هم دو از همین واکسین گرفتیم، واکسین کووید و واکسین انفلوئنزا.
آره ما این ویدیوها را همیشه نگاه می‌کنم از در تلگرام کسته. باز یک روز که زیاد میگفت گرمه او رو شب نگاه کردم میگفت شمال هم است، خیلی شمال خطرناکه. دیورست کنسیل بودم روز نمادی بس بچه‌ها در اسکول رفت با چه میدم صاحب کار خو مسیج کرد که امروز زیاد هار ما نمیتونم هم ده. خوب شد. خود من کوکینم صبح وقت که والشتم در مورنینگ کوکینی چاشت شب تیار کردم زیاد گرمی میشه.
Since 2021, we've created more than 100 videos in 6 languages. That's over 600 videos. These videos have been seen more than 22,000 times. We've also provided over 25 pop-up vaccination clinics along with information forums throughout the years. It has been a really rewarding partnership and one that continues today. We're constantly working together to make sure that these communities have vital information on all sorts of health issues, from vaping to eye gas to flu to gastro, and we're continuing to work together to create these resources for these communities.